A very warm welcome to all of you. I know this session that we're going to do today is very, very interesting. And let me take a moment to kind of set the context for this. We witnessed the third wave of the pandemic surging across globe, pushing businesses to assess their continuity measures. But this time around, the world leaders seem to be better prepared. And I really hope that we all agree to this. So as we witness the rapid spread of the Omicron variant of the COVID and WHO warning us of a possible new variant, all of which threatens to realign people and processes, global leaders are now preparing their organizations to live with this COVID uncertainty, or if I may say, the black swan events of the future. Planning ahead, organizations across geographies are prioritizing the health and well-being of its people while rewriting the rules for healthier, more inclusive and sustainable workplaces. To discuss and deliberate more on these lines, we are glad to welcome you all to this live roundtable discussion on India Incorporated Thinking Ahead and Beyond, the future for well-being amidst and post the third wave, presented by Practo and ETHR World. Please join me in welcoming our esteemed panel of speakers, or if I would say the members for this session, Mayank Rautela, CHRO, Care Hospital, Avantika Nigam, Senior Director and Head of HR, Global Business Services, PepsiCo, Vijay Chandra Mohan, Head, Corporate Real Estate Services, India and APAC, Cap Gemini, Sushant Malia, Senior Vice President, EH&B India Leader, OPD Insurance Solutions, Marsh, and Vinesh Nair, Head HR, Practo. Thank you so much for joining, everyone. I hope you're having a good day and are all set for this discussion. And you can give me a thumbs up. Great. Thank you so much. And just to let our audience know, you can keep sharing your reflections, your questions for this illustrious panel that is there with us. And we'll take these questions during the course of the conversation or maybe at the end of it. So I'm definitely going to keep an eye on that. And without wasting any time, I just want to kind of deep dive into this conversation today. So Avantika, I would like to start with you and understand from you the current status of well-being interventions at the workplace amid the third wave of pandemic.
Thank you so much for the question, and it's great to be with all these panelists, and thank you to all the participants who are on this webinar today. It's a great question. I think, we've been through this 2 times. The first time we were bracing for impact, but there wasn't too much impact. The second time we were caught unawares and there was massive impact where, we saw a shortage of medicines, a shortage of oxygen, a shortage of hospital beds, much more serious variant than there had been in the first year. I think that was really the time about 7-8 months ago, where all companies set up a lot of infrastructure, both physical infrastructure, teams that were supporting someone who needed information or someone who needed medical support, as well as a lot of soft skills capability building, right, for teams to manage. So I'll delve into it a little bit more in a bit. But I think from there, as we've entered into the third phase this year, we are all finding ourselves, like you said, much better prepared because we've been through it in the past. It is sort of familiar. We are fortunate to have a slightly milder variant doing the rounds right now. Most of our employees are vaccinated. PepsiCo sponsored vaccinations, and we organized vaccinations for all our employees. When it became available to us. And so I think, we're all in a more comfortable place. But having said that, the infrastructure already exists. We have vendor partners who support us with, online doctor services. We have medical tie-ups where employees can get the right support they need, whether it is for advisory, whether it's for physical checkups, tests, etc. We have a lot of the softer services like tiffin services and other support that one might need if they're sick. I think in addition, we've also been able to, put in a lot of effort into getting managers and peers and colleagues, etc., more trained on demonstrating empathy, making sure they're there for their, for people who might not be okay. We have a very, very comprehensive leave package that supports employees if they need to either take leave to recover themselves or be a caregiver in the process. So I think a lot of great work across a lot of different areas that has been done by the industry at large, which has made us much more ready for the current situation. But I think one very bad, I think slightly delayed change that most of us made was also around our insurance plans. And I think Sushant, my colleague, is better placed to talk about it in greater detail. So why don't I hand over to Sushant? And Sushant, why don't you talk more about this?
Hey, thanks, Avantika. Thank you so very much for organizing this and having us here on the panel. I think, like rightly said, unprecedented 2 years. I think nobody had envisaged this sort of a situation to occur, and the length of the event per se. From a pure play insurance standpoint, I think what we have seen from a change perspective is a lot of organizations have come back to us with specific pandemic covers. There is an inherent need of a total upliftment of the benefit structure from an insurance perspective, at least. Inclusion of model coverages like home quarantine, hotel quarantine. Your voluntary plans have got enhanced, which means our employees were wanting to have more coverages, right? There were inherent needs of benefit plans where employees could get lump sum payouts in event of criticality. We have seen a lot of mortality, and that's when the family needed that much care at that point in time. Cut to that, we have seen a solid development on the primary care side, which means we were in a situation in the second wave where we were not getting hospital beds, and at that point in time, the reliance was more on teleconsultation, video consultation, and I think it was chaotic, but the niche and something that employees and people couldn't adapt pre-COVID, people started gluing onto those thoughts. People are now ready to get to specialists through a video chat, through a teleconsultation. People are trying to look at more preventive care mechanism by virtue of involving diagnostics, vaccinations. So primary care is at the forefront. Not to take away the fact that it's also getting built on strong digitally backed solutions, which gives a bit more flexibility for employees to choose better. We've also seen an uptake in terms of women health, especially under the primary healthcare segment. People are buying insurance to ensure that there is fair amount of women health cancer scanning for coverage specifically for autism of kids. We have seen pregnancy care programs at its peak, and all this is a paradigm shift from a severity-based insurance buying to a frequency-based buying, which means people have started to realize that there is a big spend that happens outside of the hospital spend that otherwise people would think, which is a major spend. You may be surprised to know close to 62% of an employee's spend happens on a primary healthcare, which is uninsured today. And that's the potential tab that market has done over a period of 2 years last, where we have started to see primary healthcare insurance at its peak. And the last point was, I should not miss this, the geriatric care, the elderly care is something that has picked up big time. There were a lot of planned hospitalizations that have kind of moved forward because at a point in time, we had seen healthcare infrastructure only catering to COVID, and planned hospitalizations were handled at a status quo. So geriatric care is again at its forefront because that's where the severity and the magnitude of payout is very, very high. So we've seen uptakes in these sectors.
Great. Thank you so much for that, Sushant and Avantika. I think couldn't have agreed more that empathy was one of the prime factors. But you're not just coming out and saying that there is a shift in focus now. So thank you for putting that across. And I'm now going to move to the other half of the panel. Global studies say that while many organizations take steps to manage employee fatigue in the workplace, there are fewer efforts to proactively manage the issue of employee burnout. And that is something which is very relatable, I think, to the audience, to all of us at the moment. So I just want to know that, with organizations becoming more complex, employee burnout definitely remains the biggest hurdle to progress. So what are we doing about it? And I would just come to Mayank first on this and then move to Vijay and Vinesh.
I think more than anything, I'm really excited and proud to be here today on this forum to talk about this topic, because I represent close to 8,000 healthcare workers who've helped us brave these three waves, and I would not do justice to my role if I didn't talk about their contributions and how we have about 10 hospitals across 5 different cities, and we have over 2,500 nursing staff, technicians, who, while many of us were thinking of how do we not go step out, or maybe a Google and a Microsoft introduce work from home, we had no such option. We had to ensure our staff was motivated to get up every day, come to work, and also then when they go back to their homes, they are safe. And a large population of our nursing staff, we put them in our nursing hostels. So you can imagine 400 nurses staying in one building, and what it can happen, and how overnight we have to create new facilities to kind of keep them safe, the ones who did not get the infection. So that's where I wanted to start off in terms of managing organizational complexity. Hearing what I just said, it's a very, very complex setup that we work in. Our employees are from a ward boy to a star physician who probably charges by the hour, so or for per surgery. So that's the complexity of the organization. So how we kind of tackled it, we said, let us standardize our org structures. I remember when I started off my career, one of my earlier managers said, Mayank, in HR or in any business, first look at the structures. So we looked at the unit org structures, we redefined them, we standardized them, then we standardized and built our policies were made stronger. And I'm really happy to share that probably we are one of the first hospital chains in the country where 100% of our 8,000 employees have their KRAs and goal well defined on an online system. So today if there is a nurse in a ward or a technician is in a cath lab, he or she knows what are his or her focus areas and what she needs to, what is it that he or she will be assessed at the end of the year. And while all this is happening, I think the best way to manage complexity in an organization or in a society is to connect with your people. So leadership and connect becomes critical for us, especially in the industry we operate. So we have launched a lot of employee connect programs. Many of them are done in many of the organizations, but for us it gets very tough because, like I said, we are spread across shifts and locations. So some online connects, majority of our employees do not have email IDs, so we can't do forums like this. So we have to send out recorded messages. We have to do in-house, in-hospital sessions. So that's how we did on Employee Connect. Coming to employee burnout, I think probably the healthcare industry would face this burnout the most because you are in a PPE kit inside a COVID ward. I don't think it can get tougher. So we launched a lot of employee-friendly COVID policies. We redefined the way we manage our hostels. We upgraded them for our nursing staff, and like Avantika also said, we had no choice, but we ensured that 100% of our staff was vaccinated. And we this year, we don't know whether the fourth wave will come or not. We are redefining our manpower structures and our manpower numbers basis what if this happens. So that's how we are managing in a complex org structure or a complex world today, ensuring that our employees continue to contribute not just to care but to society at large.
That's a very valid thought, and kudos on those efforts, Mayank. I think that's something that's really a milestone, and we should definitely applaud it. So great work done there. I'm going to quickly move to Vijay. Would love to hear your inputs.
Absolutely, and thank you, Soumya. Thank you so much for this session. And it's wonderful to hear peers in the industry and what they've done. And yes, corporate India has kind of geared up and a little bit more mature than where we started in 2020. Right, and the kind of work Mayank just spoke about. I mean, they were absolutely heroes in the healthcare industry, taking us through. But as an industry that I represent, right, which is service based, and a lot of people in terms, about 170,000 employees for us in India, the entire thing we need to realize, and what has become evident, is that yes, there is increased complexity. I mean, we went on to different things of, work from home model, hybrid model, come back to office, go back to home model. A lot of things kept changing. And even the whole work, the way, the process used more of technology, more of remote, different procedures, protocols. So all of this is stressful to the employee, and the pandemic itself, right? Like, and you heard Mayank say that people went through a lot of churn. So definitely, it is for us to acknowledge that the stress levels with the workforce has gone up. And in some sense, if you go back prior to pandemic, the entire act of people coming to a physical office, going and meeting people, colleagues, it was a medium where, it was, colleagues were just a little bit more than colleagues. They were friends with whom you could share, you could discuss. And in some sense that alleviated, some of the stress that was probably pent up. But today, I mean, we have much less curbed social interactions, and again with a set of people that we know, and it's quite limited. Right? And all of this has an impact. And mental wellness, if it was important earlier, and in today's world, I think it's unavoidable to ignore. So key thing for organizations like us is, number one, we should be aware, and we should not kid ourselves that there is an increased level of stress. Let's just not brush it under the carpet. Second, on the basis of this awareness, organizations like us, we devise focused intervention strategy. And these are both proactive and, reactive or corrective measures, so to say, right? Like more often than not, what organizations end up doing is, providing access to counselors and, some kind of employee assistance program, giving a number to call. Yes, that is correct. That is important. It's very relevant as well. But again, there we reach a place where, the event has occurred, it has happened. So for organizations, it's increasingly more important. How do we prevent this? How do we go further left? How do we start identifying early warning signals? How do we introduce programs, which lets people connect, right? And for many of us, at least in our industry, the new working norm actually starts to formalize some of these interactions, right? Earlier, it was done very informally. I would take a team out, I would interact, but then we started putting structures towards this, A, B, C, D has to happen, and it has to be a part of a checklist of managers, of leaders. How do they go about, these interactions, and how do we encourage certain positive behaviors, and how do we encourage certain preventive or rather awareness, increase a lot of awareness so people can identify and not wait for that event to occur and then go for it. So I think for organizations, at least in this, what we have realized is that not just looking at the post fact, but how early we can start has become extremely important and relevant as well.
Thank you so much for that, Vijay. I'm going to quickly move to Vinesh now.
Thank you, Soumya. And fantastic to be here, speaking to all of you and being part of this amazing panel member. Now, the advantage of speaking last is that I don't have to talk too much. I just have to summarize what my two earlier panel members said. 2015, 2016, all of us had our plan 2020 in our PPTs and presentations of planning ahead. And then year 2020 had a plan for all of us, right? And we kept, like Vijay mentioned, we kept doing the back to office, back to home, hybrid, this breed, that breed. There's never a right answer for anything, right? Each organization have been trying to figure out its own ways and means of working. I represent an organization which is kind of the one between the provider, which is the doctor, and the patients. And like Mayank said, a huge shout out to all the frontline workers. It has been absolutely been crazy for them, and we can really understand. But I take a lot of pride in saying that the folks at Practo really stepped up during this period. Everybody realized, and we were having constant conversations about the whole burnout issue. They said, Vinesh, one code जो मैं लिख रहा हूँ, it could possibly save maybe that one patient getting connected to a doctor. So there's an immense pride, but we can't shy away from the fact that what the whole pandemic has brought, or the work from home has brought, is a blurred in between life and professional life, right? We are perpetually on a call. Earlier, you had a possibly 9 to 6, 9 to 7. You knew that the moment you log off, you had your own time, but currently that's not the case. Perpetually on calls. So how is it that we possibly deal with it? It's a reality, and we accept it. So at Practo, a lot of things. Thankfully, we are an organization which has a lot of doctors in-house and have access to a lot of doctors on the platform. So one thing that is free to all Practians and their family members is the access to all these doctors. And it is not just physical health, but mental health, counselors, psychiatrists. And we didn't limit it only to the employee or the Practitioner, as we call them, but also to the family members and friends. So in case any of them also need it, they're also free to do it. It extended to medical tests being done at home, or medicines being delivered at home. All of them got covered. We ensured that there are regular webinars that are being done on how do you keep yourself motivated, how do you keep yourself engaged, take care of your whole mental well-being, physical well-being. One of the biggest thing is that people have, for lack of better words, started putting on a lot of weight because you're constantly sitting in front of your TV and your monitors and not really getting any time to work out. So how do you do that? Fun Fridays was one thing which I normally, as a word, used to hate because I just thought that it was gimmicking the entire HR fraternity. But I realized that the whole Fun Friday made a huge comeback. And from having stand-up comedy to live music, I think that provided a huge getaway for a lot of employees over at least one Friday. What we also did is we realized that people do not necessarily have to talk to a doctor or their manager to seek support. Peer support group. We created a peer support group on our Slack channels so that if anybody has a challenge, they just put it up out there, and somebody in that area, in that vicinity, whoever is available could possibly help out. So I think Avantika mentioned about the tiffin service. We didn't have a tiffin service per se, but if I am staying alone and I'm not well, I had somebody who would drop food for me at my doorstep, right? That itself took off in a very big way, and people started bonding really well in the times of pandemic, which normally is not really the case when we do not meet each other or see each other. We also made it very normal to have toddlers in the meeting or suddenly a pet jumping from somewhere. And we didn't make it a point that the moms or the dads would shoo away the kids or just hide their pets or whatever. We just made it normal because we are in their space, right? We have just come back, so we need to ensure that they're as much part of the whole ecosystem that we are in. A lot of organizations have also done things like no meeting Wednesdays, Thursdays, name it whichever day, longer weekends. So, like I said, there has never been this one thing that has really worked for every organization. I think it's a combination of various things that we have all tried to do, but and we continue to do, I think.
I think that's the spirit and that's the thought that counts, Vinesh. So thank you so much. And yes, I couldn't agree that yes, you're sitting and you're putting on weight for no better lack of words, if I would say. But HBR says that sitting is the new smoking. So just kind of really nodded along. But thank you so much. A lot of conversations have been around that we've talked so much about the pandemic. What's next? But when I hear such beautiful stories, I think that really kind of pumps us up and tells us that, this pandemic has given us a lot of learning. So thank you, everyone, for putting that out so candidly. And a great way for a discussion is that it takes its own course. So if you're on the right track, it will always take its own course. And that's exactly how we're moving. That brings me to the next question. Since we've already discussed the new burdens, the new challenges that are already happening for corporations or organizations, and as well as our leaders, as they're trying to balance the existing sustainability goals with meeting new health and safety requirements. So now I would really love to understand from all of you here that what's on the agenda and what strategies are deployed to make this work. And Sushant, I'm going to come to you first for this one.
Yeah, I think from me, you will get to hear more on insurance. But insurance being one of the most dynamic things around the past 2 years. Yes, I think this is a segment which has kind of seen the maximum change, the maximum pressure. We've seen, my co-panelist will not deny the fact that a couple of insurance sectors have kind of thrown very, very different challenges. Starting from the life insurance standpoint, we had situations where I was just deliberating with Vinesh a while ago, that we had situation that till date while we speak, there are a couple of corporations, large ones, who may not have probably bought life insurance. Surely because of the fact that life insurance industry is reinsurance backed, and the reinsurers were not prepared to underwrite risks like this. Courtesy the unprecedented times, the mortality statistics have been very, very different. Long drawn, we were relieving the mortality statistics of LIC, which was way back. I think pandemic will bring in a new statistic that the reinsurers and the entire insurance market will bank upon. Obviously, there is a major change. There is a burden. There has to be somewhere a sustenance that needs to be bought. We are in a regime where we don't have, when I'm talking about employee benefits, HR, we don't have healthcare regulator in India. All we have is an insurance regulatory development authority who regulates insurance. That's the irony of the situation we are in. So you may have, with all due respects to my co-panelist Mayank being here, there have been changes in the way the treatments are being offered, right? So we have to really depend on the network that an insurance company could derive better from an employee perspective. Having said so, yes, from an organization standpoint, leading organizations, new age organizations, startups, everybody are kind of demarking the severity-based illnesses or treatments and frequency-based illnesses differently. There is a clear-cut demarcation. To answer this question, Soumya, I would throw a couple of statistics on some deep stick that we did at Marsh India around a reasonable client base of ours. Starkingly, one of the two organizations focused on reallocation of the budgets and optimizing it to the fullest. Does that mean that they were not optimizing it earlier? No, it doesn't mean. But all it takes is a reinvention that they wanted to look at. flexible benefit solutions like flexi hours that Vinesh just pointed out, or Avantika mentioned about. Flexible benefits in insurance is the in thing. Pre-COVID, we used to have 54% of the organizations who were working with us having flexible solutions, but today they are 84%. I think that's the picking up. People are trying to offer flexi work conditions. They're also offering flexi benefits also. Well-being has come up in a very, very different. There is a rise of close to 81% where of the organizations who are looking at primary care at the forefront. They're talking about good health conditions whereby severity of illnesses could be curtailed. The cost of the organization is maintained. What's the cost of an organization for an insurance? The higher the people fall ill, the insurance pays more, the premium gets bloated. Unfortunately, in India, the health insurance sector is not reinsurance backed. So everything that the insurers pay is on the net. So you have that as a grave situation to be in. We were fortunate that reinsurance was not backing health insurance. Otherwise, we would have been in the same situation as life insurance, you may say, in a different way to look at it. Coming back to the sustenance, organizations are really looking at refocusing on ensuring that there is a holistic strategy in building insurance program, which comprises of your inpatient cover through insurance, and outpatient cover, which is a primary healthcare cover, additional support that can be brought for critical illnesses. There is a big focus, big focus on mental health today. I think that's the thing that's going to be the next big segment where corporates will start looking at differently. And other areas of focus remain constant. I think that's where the organization is striking balance. So maintaining statutory obligation or so-called statutory obligation of insurance plus is something that the organization is striking an equilibrium to balance.
Thank you so much, Sushant. I think that was fabulous. These data points, our audience would definitely love them. And I'm sure I have taken a note. So make sure if you missed it, I can share it. Thank you so much. Mayank, I'm going to come to you now.
Yeah, so let me start by giving you a quick background on one of our units. So one of the hospitals that we run is a 50-year-old building. So there used to be a Russian hostel there while the Vizag port was being built for about 10-15 years. Then it became a hotel. And then we started about 20 years back and converted it into a hospital. So that's the sustainability of that building, which is providing care to patients. Now, how do we take the sustainability to the next level? For various reasons, we can't continue in that building anymore. So we are moving into a greenfield project in the same city. So we will be moving 500, 700 staff from one unit to the other. We'll be communicating to our patients that we've moved, so you can come here. In another state where we operate in Odisha, we are doing a public-private partnership with the government of Odisha, where they invest some money to set up a hospital, but then we go to that far-flung rural area to run that hospital for that section of society. So these are the kind of initiatives that we are taking for sustainability of our hospitals and for continuum of healthcare for the patients who rely on our hospitals, not just in large cities, but also in 3-tier cities where we want to expand. And as a group care, those of you who know, we are a well-established brand in Hyderabad. Beyond that, we have grown and we wish to grow in 3-tier towns where we can make an impact on the healthcare space in that city. So that is the kind of work that we've done on sustainability, and to do that we have very strong ESG standards. So we work very, very closely and monitor on energy saving, water conservation, impact of biomedical wastes on society, how do we dispose that off, and a lot of focus is given on fire and safety. And as you all know what happened in the wave 2, so for us to be prepared for wave 3 from a sustainability perspective, we had to build oxygen plants in our hospitals. We could not rely on external oxygen being supplied. So these are some of the initiatives we've taken on the sustainability of organization on the whole. But like the topic is that how do we balance it with the health and safety of our employees? So while we were upgrading our hospitals, we are also upgrading our nursing hostels. While we are ensuring that we give good care to the patients, we have enhanced our own healthcare policies. For example, one of the policies where we provide free, diagnostics and OPD and a lot of other benefits for our own employees. This year, we have extended it to the in-laws of our employees. So till now, it was only till parents. Now even our in-laws of our employees are covered in that policy. So those are the kind of things that we are doing for our employees and balancing it with providing sustainable care to patients at large.
Great. I think these are amazing efforts. Sumang, thank you so much for highlighting that. Just being mindful of the time, I'll quickly move to a last question, and then we're going to take the audience questions here. After hearing all of you, what we can conclude is definitely that uncertainty certainly is the reality today. So from planning the hybrid work model to returning back to completely remote working structures, what has changed? And what do organizations need to do differently, keeping in mind that uncertainty is going to be the ultimate reality as they look at sustainable employee safety, well-being practices at their respective workplaces. So I know it's a little heavy question, but I'm going to come to Vijay first and then move to Avantika and Vinesh.
Sure, Soumya. And again, yes, uncertainty is the new certainty, right? So we live in this world where we thought it was going to be time bound, and then suddenly we started the A, and we are now at the O, and we do not know what next. So yes, so this uncertainty is a way of life, and corporate India is actually kind of now getting used and adapting it extremely well, I should say, to this uncertainty. What happened in 2020 is definitely not what's happening now. And with this, latest variant and whatever the peak that we went through, well, thankfully, probably to the less severity of this strain, but nonetheless, our medical systems were not as much stressed. The work did not stop. Corporate did not stop. But if you really go back to the fundamentals of this question, what has changed in the thought process for large corporations is we're very certain that things will change. I mean, in a sense, if we ever think, at least for an industry like us, if you ever think that offices are going to be used for the sake of someone coming and sitting and doing a regular work, probably the answer is no. The offices are probably now changing to why do you need an office and what's the purpose, right? And the purpose is more, collaboration, ideation, meeting, and we were just talking about it, right? Like, in some sense, the culture of an organization is actually more imbibed when people come into a physical location. In the last 2 years, and I was just sharing the stats, people who have joined, let's say, Capgemini, joined sitting in their chairs, got the laptops, worked, and then decided they will leave without even knowing what the organization, what the culture is, apart from just interacting with a few people. So yes, offices will change for the purpose of why an office is being used. We will never get back to everybody needing to come to an office at all times for doing work that they're going to do remotely. But the workspaces are evolving. The designs, how an office is today, designed with probably cabins, and this is all going to go away, in a period of time. And corporate India, I think, has kind of now realize that these uncertainties can come, they can go. How do you prepare your backend to meet some of these uncertainties, and at the same time overlook how your offices are now going to change the way people are going to come and use it and interact with that.
Great, Avantika, I'm going to come to you. Thank you so much, Vijay.
Sure. I'm going to take a little different take on this one, right? I think we've all been through the initial high of, well, there is this COVID pandemic and we're going to beat it, and therefore lots of Josh came to the table. People started working harder, etc. I felt very happy that they didn't have to get ready in the morning, go to work, etc., and had that flexibility. Then we started seeing that taper down, and now we've really reached a stage where there is an uncomfortable sense of, well, I want to meet more people, I want to interact more. Organizations also want employees to have more connects, etc. It's not happening for one reason or the other. And I think it's time for all of us to sit back and think of, okay, how do we actually make the most of the situation? Because it's not going away, right? And I think for me personally, it's been a big learning. And also, I think for our organization and where we are at right now is, we had originally thought that, we would have a reason to come to the office, like Vijay rightly said, and we had created a framework around it, saying there are 4 reasons why you come to the office, and they were, called the 4 C's in our context. You come to connect, you come to celebrate, you come to collaborate, and you come to. I'm blanking out on it, but we had. We had defined this, this framework clearly. Co-create, which is innovate, is the last one. Now, while we created this model, etc., it's been 2 years, and we're not seeing the end in sight on when is that really going to play out, right? So for us now, it is to think of how do we deliver these 4 C's, even when employees are not meeting each other at all. To Vijay's point, right, a lot of our organizations have such strong cultures. We want people to experience our cultures, and they're designed to be experienced in person. And I think what's happening now is we're beginning to realize more and more that forever, even if we're going to stay in this partial sort of hybrid environment, it's never going to be the same. It's never going to be a place where, people are going to experience our culture in the same way that they have in the past. But I think a couple of things that are emerging to my mind that, we're still trying to figure our way out on, really. The first one is, how do you tackle the feeling of loneliness? We're getting a lot of feedback. I don't feel motivated. I don't feel like I'm having fun. And how do we deal with that feeling? Because the reality is that your calendar is running your day. And in your calendar, you're going to meet a few people. There is an agenda. Everybody wants to get that agenda done. Zoom fatigue is setting in, etc. So really what we are coming to right now, and we're still evolving this in terms of actions, is there is an I need to do X, Y, Z for myself. That might mean I need to take charge of my day. I need to work out. I need to make sure that I'm happy. I need to make sure that I'm making connection. And then there is what the organization can do. And the organization could be my manager, my peers, my leaders, etc. But how do I form those connections? How do I find the time to make time for collaboration? Because we've established that knowledge workers can operate from anywhere. You don't need the office, right? So I think that's really where we are right now. I think the other big challenge is, how do you develop people in this remote environment or in this hybrid environment? Because we don't really have the tools to that. It's not about going through an online course. It's not about going through some content. One very important element of learning at the workplace is learning by observing. Learning by observing your peers, learning by observing your boss. It's all gone, right? Nobody's observing anybody anymore. So I think that's where we are right now. We're trying to figure out how we are going to replicate all of this. And we've sort of made peace with the fact that this is how it is. So now it's for us to find the solutions, along with our employees.
Thank you so much for that, Avantika. Always the honesty pays off. We still all are kind of figuring it out, that what's the permutation combination that's going to work out. We don't know. But like I said, these efforts matter. This intent matters. So thank you so much. Vinesh, I'm coming to you now for the concluding thoughts.
I don't have any more thoughts. I think both of them have taken away those thoughts that I had. But I just thought that I'll just go through some of the experiences that I've had in the last 2 years and what I've been thinking, right? 1,000 employees working remote is purely from an organization point of view, is right. Ensuring their technology is fixed. How do you ensure that their bandwidths are all there? You don't know who and where these employees are. So it's a huge challenge from an organization point of view of ensuring that people are there, people are able to contribute. Work from home is no more a benefit, which all of us used to, be tom-tomming about in campus drives or whatever, that we have work from home. It is a reality. Today it is Corona, tomorrow it could be Budweiser, it could be anything, right? But the fact of the matter is that all of this is there, right? So how do you? And I think people have accepted it, right? We have seen. I think when we covered it, March, April, May, when we went into the lockdown, the productivity just shot up. Over a period of time, we also saw the productivity come down because fatigue creeping in, right? People were overworked, people were burning out. But I think over a period of time, employees and organizations have realized that there is a certain pattern that has kind of emerged organically, right? Today we know what is the performance indicators, what productivity levels can we expect from folks. I think most organizations have been hiring like crazy during this period, right? I know for sure that we have grown 2x in the whole Corona period, and most of them have not seen other just the face, right? And that too, if people switch on their cameras. So how are they experiencing the culture? They have not seen the office. They have not seen. We take great pride that we're in a WeWork office. It's a cool office, but nobody is there, right? First wave done, we said, okay, the leaders will walk the talk. The leaders started coming in, and we had more folks coming in. We saw the collaboration go up, the efficiencies going up, great stuff. And then second wave happened. We had to scurry back. We started coming back sometime three months back. I mean, as we speak, I'm in office today. I thought it's a good idea to be in office and speaking about this because I had possibly thought this is a question that would come my way. But the fact remains that organizations will never possibly come back 100% to work. For organizations who are planning to take new space because the people they've increased the headcount, so they would need new space. I don't think it will ever be 100%. I think people are now planning for 60 to 70%. With the great resignation in place, with tech teams not the high kind of don't possibly get to hire. How do you ensure that the system? How do you provide them this flexibility? I was talking to one of the partners whom we are working with closely for our office space, and they said that they've seen 40% possibly organizations who are trying to come back to office in some way or the other. And majority of them are smaller startups, right? Because it's easier to manage because the numbers are possibly less. I would imagine for Vijay and for others here, the numbers that they are managing is just as crazy. So yeah, there is no right way, right? And a lot of people on this panel, the HR folks, I'm sure they are feeling, sometimes they feel like God, as if we have all the answers, right? Unfortunately, sometimes we don't have the crystal ball, we don't have those answers. We're also trying to figure out what is the right way. But yeah, muti, I think this is how it would be. There would be hybrid models, there would be some back to office models, whatever works for each organization. There is never a one size fits all, I guess.
Great. Thank you. And that was a great sum up, Manish, that one size doesn't fit all. And I think that's exactly the journey of each one on this panel has been in these years. And I'm sure it's a roadmap ahead. So thank you. Thank you for summing it up so beautifully. I still see we have some time for the questions, and I made a promise to the audience. So I'm just going to quickly go back to it. Let me start with one question. And Vinesh, it would be great if you take it because it's actually directed to you. What are the organizations doing about mental health in such uncertain times? How are the leaders here using technology for this? I think it's going to be a great anecdote because like Sushant said that, mental well-being is the next big thing that we need to focus on.
No, absolutely. Thankfully, mental health or discussing about mental health is no more a taboo topic, right? We have started talking about mental health, and it's a real issue, and people are addressing it. From whether it is a celebrity to a common man, I think everybody is talking about mental health. What I can possibly talk about Practo to be more specific, because I can only talk for myself, but I'm sure that a lot of organizations are doing it. We have something called as an early warning system in place, and this is not just for the mental health, but this is an HR tool. We have a AI bot which typically talks to employees through the course of their lifetime at Practo. And what we have seen during post-COVID is that that's a great way to identify if somebody is really feeling low, and not just from a work point of view, whether it is purely from a mental space. Do they feel harassed? Do they feel overworked? Do they feel any of? And the business partner reaches out to them immediately and has a conversation. Thankfully, unfortunately, we have the advantage of having in-house counselors and psychiatrists whom we could connect. But because these are anonymous things, we actually tell them that, hey, you can go on to Practo app, and because they have access to the counselors and psychiatrists, they can do that. And these are unlimited discussions and absolutely available to them free. There are conversations that we get managers to have with people. Employees. Over communicate is the slogan that we had used when we went into the lockdown. No communication, how much ever communication is less. Over communicate over this. So continue to talk to employees, do more town halls. You don't have to do town hall at org level. You can do town hall at team levels and function levels to talk to people and communicate what's going on. I think these and some more. There are a lot of online apps that are currently available. I think even in the budget this time around, there's a lot of focus laid on the health and particularly the mental health side of it. So my advice to this is, because I'm from Practo, I will definitely say try Practo, but as a tool. But I'm sure that there are others also who are trying to solve the space. By providing the right advice. You have the EAP services that are available for employee assistant program. So, yeah, but talk to employees. I think that's very important, and it doesn't necessarily have to be the HR doing all the talk. It's the leader, it's the peers who are talking to themselves.
Great, thank you so much for that, Manish. So just about 5 minutes at hand, and making the most of it. So I have a question for each one of you. And we'll go round robin in this. So maybe like a 1-1 prime learning that you want to highlight for this one would be great. The question is that how to create wellness strategies that are forward thinking and customized to work for the dispersed workforce. I think that's going to be a great sum up for this session. So let me just start alphabetically and ask Avantika first.
It's a really tough one, Soumya. I'm going to try and be a little quick about this, right? I think the wellness strategy has to start with connections. I think that's the one that we miss out. We look at the hard elements of mental well-being, physical well-being, insurance, hospital, things like that. But I think there is an element and there is a value of being connected. Do you have a friend at work? Do you have colleagues whom you just have fun with? And then you get to yoga classes and other interests that people might have. Vinesh so nicely referred to Friday fun, which could be any day fun, and I think that's a whole bucket that is a huge opportunity for companies. And for us, the big learning actually has been, how do you engage the family in it? So we have a family day in any case. We are celebrating Women's Day next month with moms, wives, grandmoms, the whole jing bang. Similarly, we do summer camps every year for kids of PepsiCo. We do marathons or the whole family. So I think those are some of the things that I feel, while they're not traditionally in the well-being strategy, for me, they really stand out.
Yeah. Thank you. Thank you so much for that, Avantika. So my takeaway is connections from you. Mayank, I'm coming to you.
I think for us, the unique thing is, and I think it's in most organizations, is to ensure how do we take care of the well-being of the cross generation of employees that exist in the workplace, from an 18-year-old nurse to maybe a 70-year-old senior clinician. How do we get them together? How do we get them talking to each other? How do we bridge those gaps? So it's, I think, in line with what Avantika said. It's about connection. It's about communication. It's about for us, what continues, it's WFH, work from hospital. So for us, it's fun. So I actually kind of get bored in the corporate office. So every week I step out and meet my team in the hospital. Right. So it's all about connections, I guess.
Great. Thank you, Mayank. Thank you. Care and well-being is what I take from you. I think by the end of the session, we'll have our very own framework. So we'll keep our audience posted on that. I'm very quickly coming to Sushant, you.
Yeah, I think in addition to what Avantika and Mayank said, currently I think from a well-being as a subject is very, very fragmented. From an organization standpoint, you have a lot of sporadic initiatives that you keep latching onto, be it in terms of EAP latched onto one vendor, or you're doing digital health with somebody else, you're doing telemedicine with somebody else. I think it's time that you stitch and marry the data points together, right? Ultimately, it should resonate into an idea that is not just optics for employee. Yeah. While the employee gains maximum, it's also important that the organization has data points to map. Absolutely. How would it be, wouldn't it be beautiful for organization to look at data points like red, amber, green in terms of understanding how the employee spread is?
Yeah.
For them to plan a bit better, the green ones being greener more, amber ones to try to get them to green, and the red ones to work upon. I think that's the idea at which the well-being should be taken way forward.
Beautiful. Thank you so much for that, Sushant. So my takeaway from you is the data points with a traffic red light. Thank you. Vijay, I'm coming to you now very quickly.
No, I mean, absolutely. All of them have said it. And I think all this goes back to the fact that, as an organization, is your key focus, is wellness a part of your focus, or is wellness by the way? So if as an organization, it's your priority, then you'll have someone actually looking at wellness holistically and starting to design all these interventions, right? Physical, mental, data points, prevention. But then do you have that appetite to put it at the core of your work strategy and say, it's extremely important to me, and have somebody looking at it and refining it? I think once you have that, all of these solutions fall in place.
Yes. Wellness spotlight. Thank you for that, Vijay. Vinesh, I'm coming to you. Less than 60 seconds, maybe.
Sure. I'll quickly. So for us, it has always been over-communicate and over-cautious. You do as much communication as possible and be as cautious as possible. And I think this came in because most of our folks had to visit hospitals to meet doctors and patient. Right, and there were no less than possibly the frontline workers because you were still meeting them. And how do you tell them to go to offices? They had a family back home, they had toddlers at home, they had aging parents at home. So how do you ensure from ensuring that you take care of extra insurance for them? Providing them the right reimbursements for anything that they possibly use, from a mask to sanitizer, you name it. But I think even for people who had to come to work, we were extremely clear that don't come to work unless it is absolutely required, right? And then that's very, very important. That it's a very clear thing. If you didn't take care of your employees, somebody else will. So you very well do.
That makes us feel very empowered. Thank you so much, Vinesh. Thank you for that. My takeaway would be over-communicate and be cautious. So thank you so much. Now is my time to kind of rise and shine for us, because this has been not just an engaging conversation, it was really thought-provoking. So thank you so much, each one of you, Avantika, Vijay, Sushant, Mayank, Vinesh. I thoroughly enjoyed. I hope our audience definitely did. I know we were a little short on time for the questions, but Please feel free to connect with all these amazing speakers offline and find answers. I hope you all enjoyed as much as we did. So thank you everyone, and have a great weekend now. Thank you so much.
Thank you.
Thank you so much.
everybody.
Thank you. Bye-bye.